It is my absolute pleasure to introduce our opening keynote speaker to kick things off. Terri Couts is Senior Vice President and Chief Digital Officer at the Guthrie Clinic. She's also a member of the CHIME Board of Trustees. And I have to say, when I reached out to Terri on this topic, she quickly accepted, noting the increasing amount of time that she herself is spending on workforce-related issues at the Guthrie Clinic. Terri's going to be sharing some insights into the leadership approaches she's using to enhance team resilience and the importance of empathetic leadership in addressing both the human and technological aspects of resilience. Terri, it's a pleasure to have you here. Welcome, and thank you for joining us to kick the summit off today.
Thank you. I can't express enough how honored I am to stand here to discuss this topic. Not only is it critical, but it can be also transformative. Building a workforce resilience in healthcare IT is something that everyone should be addressing right now. In the era defined by rapid technology advances, increasing cyber threats, and the endless demand for seamless patient care, our IT teams are the backbone of innovation. Yet we are often operating under significant stress and high expectations. Today, I want to share some strategies for fostering resilience within our workforce, ensuring that they thrive in the face of challenges while driving meaningful change in healthcare delivery. Just a little bit about Guthrie Clinic. We are an interdisciplinary health system that was established in 1910 by Dr. Donald Guthrie, who was trained at the Mayo Clinic and came to our area to use his practices there. We are a not-for-profit. We have 6 hospital campuses, 2 skilled nursing, a personal care home, and over 75 clinical sites. We cover 13 county service area, about 10,000 square miles in Pennsylvania and upstate New York. And we have over 10,000 employed caregivers. Of that, about 970 of those are employed physicians and advanced practice providers. We also offer 11 residencies and 7 fellowships. So we are a very busy organization, but our IT team is all of about 200. So how do we address all of the things that are needed at the Guthrie Clinic and keep our teams engaged? Because not only are we in an area that services a large square mileage, but we are in an area that's hard to recruit to, very rural population. Next slide. This is just a little bit of information about the demands and challenges within the healthcare system. As you can see, we have increasing demands around the regulatory compliance requirements, meeting demands around digital tools and things that are the expectations from our patients. We're strained with our provider capacity burnout. We have increasing volumes of data, and what do we do with that? How do we store it? How do we manage it? How do we keep it safe? And then the time required to do documentation keeps increasing. And these statistics are fresh statistics that you can see that 46% of healthcare workers report often feeling burned out. And if you think about our IT teams, they are also caregivers in the sense that they provide services that help enable care. Healthcare data breach costs are increasing, cyber events are increasing. So how do we continue to look at this and keep our teams connected and supported as they continue to do their very important job? Next slide. So why does workforce resilience matter? We have a very high stress environment. Healthcare IT professionals are tasked with balancing functions such as system uptime, cybersecurity, and interoperability. Yet we are all directly impacted, which all directly impact patient outcomes. We have an increase of burnout. Similar to the clinical staff, IT professionals face increasing burnout due to the constant need for innovation, rapid problem solving, and 24/7 availability. If you think about all the things that we have to do on a daily basis to keep the lights on, and now we add in the pressures of innovation, by the way, we have to do it faster with less people. How do we continue to address that burnout? And then the changing expectations. With digital transformations, the role of IT teams are expanding. They're requiring new skill sets. There's requiring greater collaboration and higher adaptability. A resilient workforce is not just about handling stress. It is about thriving through challenges, maintaining innovation, and sustaining organizational success. Next slide. So here are some strategies that we can discuss about how do we build workforce resilience. The first is foster a culture of purpose. Link the IT team with the work that is being done to patient outcomes. Help the teams understand how their work impacts lives. For example, remind the cybersecurity team that they are protecting sensitive patient data, but also remind the cybersecurity team that they need to integrate with the infrastructure team and some of the other teams so that they don't block the ability to do patient outcomes. Remind them how we connect the EHR optimizations to the efforts of reducing provider burnout. We need to celebrate our wins. We need to recognize the achievements, whether it's a successful go live, improved KPIs or innovative solutions. But I would even say, even how do they handle themselves in a professional manner in front of staff? How do they, what that call that happened over the weekend that they had to take away from their family, recognize those things, because even a verbal recognition matters. We need to invest in skill development. I mean, as the digital platforms continue to change, we have to change how we deliver and the skill set that's needed to support that. So we have to offer continuous learning opportunities. I can remember when I first got into IT, our continuous learning opportunities was really functioned around soft skills. That's changed a lot. We have to understand the cloud. We have to understand digital enablement. We have to understand all of these informatics related tools, because if we don't, then we can't support the clinician in enabling that care. We need to create programs for technical certifications, leadership training, and emerging tech exploration. We also need to make sure that we have mentorship programs. When I first joined the Guthrie Clinic, we were even a smaller IT system, and we had very multi-specialty teams that owned a lot of different things. And so they would jump around because they were always trying to figure out, how do I get the next title or the next pay jump? But we need to encourage our senior IT staff to mentor junior team members, put in a career ladder, put in opportunities that they can still develop and hone in on their skill set. They get in an area for advancement, but then they can foster that growth and still feel connected to the organization. We need to build psychological safety. And what I mean by that is we need to make sure that we foster an environment of safety, an environment of being able to stop the line, to ask questions, to promote open communication. Team members shouldn't feel like if they share certain challenges that they might have a fear of retribution. Make sure that they have the ability to question and to ask for answers, and maybe even admit for mistakes. Normalize the learning from failures. Failure doesn't necessarily mean that it's a bad thing. Failure means that mistakes happen. It's inevitable. We all make mistakes. So frame these opportunities for learning and growing. We need to prioritize wellness and flexibility. And I think this is even more important. We may not have hospital beds full of COVID anymore, but the effects of COVID is still there. Mental health resources is not just the job of HR. It is the job of all leadership. We need to provide access to mental health programs, coaching, peer support groups, understanding what your staff is going through. There needs to be a work-life balance, leveraging hybrid work models where possible, ensuring that team members have the flexibility to balance personal and professional commitments. After COVID, most of my IT team is still remote. And one of the things that we worked through was whether or not we should bring them back on site, and whether or not innovation stopped because they weren't all in one room. But what we had to face was that in our environment, there were services that no longer existed, services for childcare, services for elderly support, maybe even transportation services. And that ability to work remote and to have that hybrid environment where they had 4 hours gave them the flexibility that they were still connected to the organization, but they didn't have to choose between the organization and their family. Strengthen team cohesion. Cross-functional collaboration helps break down silos. You need to foster this collaboration between IT, clinical, and operational teams. My team rounds all the time, every team member, including desktop, because if they don't round, they're not connected to the work that's being done, and that is very important. Team building activities is just as important, and we can do that remotely. We do it all the time. We have a huddle system that we participate in, and we have team breakouts on teams that allow us to do fun puzzles, or maybe it's a talk like a pirate day or those kinds of things. But those allow you to release the work stress, collaborate with your team members, get to know each other in a different kind of setting. The stuff that would have happened at the water cooler still can happen in these virtual environments. And then finally, I think we need to really provide strong leadership. We need to lead with empathy. And what I mean by that is we need to understand the unique pressures that our teams face, both personal and professional, and we need to show genuine care for their well-being. And I can't express how impactful that is when you can sit down and you can have a conversation about the person's mother or maybe their pet and just understand the things that they're going through and show genuine interest. And finally, I think you need to set a clear vision. Resilience is bolstered by clarity. If people don't have the information, they make up their own. And a lot of times if they make up their own, it's not the good stuff. So communicate the why behind the projects and the initiatives and keep your team aligned and motivated. Next slide. So a lot of this is that I spoke about on the last slide was really around how do we do this with different skill or different strategies. But there is a role that technology can help play to helping make your workforce resilient. And this is kind of funny, but AI and automation, it's like the buzz term everywhere. But it can help free up your teams too. Free up your teams from repetitive tasks that allow them to focus on higher value and creative work. That's where they get their energy from. So allowing them to do that is going to help foster their resilience. And then also have data-driven insights. Use analytics to monitor team workload, identify stress points, and proactively address burnout risk. We use PWA tools to help track against tasks so that I can see not only is a certain team overloaded with certain projects, but that's how we do our intake process. That's how we educate our operators on what we can do and when and how do we prioritize. And it's also how I advocate for new staff if we are growing and we need to have additional support. So I am imploring all of you as a call to action. Building resilient workforce in healthcare IT is not optional. You don't go into healthcare to make a bunch of money. And you're not in healthcare IT because you're going to be popular. I was just saying that earlier today, that they either love us or they hate us in IT. There's usually not any in between. You hear about all the problems and the big wins, but the in between, it can be very difficult. And it's necessary for sustainable success. Resilience is not just about enduring challenges. It's about thriving in the face of them. So as leaders, it is our responsibility to create a supportive environment where our teams feel valued and empowered, to equip them with tools, training, and resources to excel, and to inspire them with shared vision and purpose and the impact that has. By doing so, we're not only ensuring the well-being of our workforce, but also the delivery of exceptional patient care through innovation, which is why we're all here. I want to share a little story about, to give a real example of what I mean by these strategies. Earlier this year, we had an acquisition. About 2 months later, that acquisition was not fully transitioned um, off of those systems from the hospital that it divested from, and they had a cyber event. It brought that system, all of their systems down. They had nothing. So they were in full cyber mode where they were running labs back and forth. They had to have runners for orders. They had to have radiologists read images from the modalities and then dictate handwrite results and run those back to the ER wherever they needed to go or fax them. Our phones, they couldn't answer. Couldn't pick up voicemails. Our patients were impacted. They were in a state of crisis. And we had always planned on deploying Epic there in our core systems that was at the rest of the legacy Guthrie Clinic. But we had a longer runway for that. The traditional runway where you go and you look and you do the workflow analysis and you build out the exceptions and you deploy, you have a robust training plan. But on May 8th, when we had that cyber event and we realized how critical it was, we asked the question, should we do this faster? And after everybody's mouth lifted up off the floor, because of course that's a lot, we decided to deploy Epic in 30 days. And the way that we got the team around that is that they witnessed firsthand the patient care impact that happened. Their neighbors were involved, impacted. Their families were impacted. Their friends who worked on the floors and the nurses who were struggling with caring for patients were impacted. And they aligned around that mission and around that purpose. And they did the work that needed to happen. Was it hard? Yes. Did they get a little bit of pushback? Yes. But I can tell you that there was a lot of energy around it. And it was the why that drove them to this. So I think that, if we understand the why, if we align it to a good mission, we have leadership support, they get the resources they need, they obviously were well fed, that allowed them to do something very important to enable care at a hospital system that needed help. So I want to thank you for your commitment to shaping the future of healthcare IT. Together, let's lead with resilience, purpose, and compassion to create a stronger, more conducted industry, and make sure that we can support our teams in a way that grows them into leaders that is going to continue this effort.
Thank you so much, Terri. Appreciate you getting us started and sharing some of the strategies that you're employing at Guthrie Clinic to help really build a more resilient and thriving workforce in the organization. We've got time for a couple of questions, if you're okay. Yep. I'd really like to start with, and I mentioned this in my opening comments, that when I reached out to see if you'd like to participate, you said, yes, I'm spending a lot of time on these issues. And I'm just curious, sort of gauging pre-COVID versus post-COVID, are we talking a significant amount of your time now in terms of the time as a leader you're spending on workplace issues?
Yeah, I would say a good 60% of my time is really spending time understanding the challenges that our team is having, understanding the challenges that we're having with recruitment. What are the things that are important? Because as we recruit new staff, the things that were important to me is not necessarily important to those that, from generational changes. We've had to expand how we look at remote work and expand it across the states and allow different flexibility there. Even how do we support individuals who live outside the state that can then work for an environment that they may never even physically meet their team members. It is a significant amount of my time.
Yeah, and of course you mentioned that yours is a hybrid work environment, right? Here at CHIME, we're 100% remote. There are pros and cons, right, to all of these work environments, whether everybody's on-prem or everybody's remote or hybrid. It certainly sounds like the hybrid approach is working really well for you and in the Guthrie team. You shared a couple of fun examples in terms of how you build that team cohesion, but thinking in terms of fostering collaboration and trust, right? And it can be a little more challenging to do in a remote or even hybrid environment. Can you speak to some examples that that you're employing there to help build some of that collaboration, that collaborative activity and trust across your team?
Yeah. So we do a lot of different things. So at least 4 times a year, we do come together in a group. We even fly in the individuals that are out of state so that we have the ability to kind of reconnect, to see each other, to celebrate, to even just have some downtime to talk about things that are not work related. Um, I think that is just as meaningful as the day-to-day work. I, our my management team has done a lot of work around making sure that they have touch bases with each individual, and then we even level up. So not only does my teams meet with their members, but I meet with them as well on a regular basis, just to hear. It's not talking about work, but just to hear and connect. I
Yeah.
think that connection is what's missing. We do require cameras on, and one of the reasons why we do that is because a cat jumps in your lap or you have a particular photo in your background. So those are all conversational pieces that allow you to connect with individuals and just having fun. I think, we do, we're always about now, timelines. Just having fun is something that we try to implore as well. I have a very creative leadership team that helps me with that because I can't say that I'm all creative, but they do a lot with just making sure that the team members feel connected. That doesn't mean that we don't measure outcomes,
Yeah.
but it's easy to measure outcomes if they're, because if they're working, they're happy.
Yeah. You said it really well earlier. Nobody comes into health IT to get wealthy or be popular, right? So, doggone it, we better be having some fun, or at least creating opportunities to have fun at work if we can. Terry, you also said something earlier in your comments that resonated with me, that you're not just a health IT executive, you're a health executive, right? And your responsibilities span well beyond the IT or digital health world. One thing I hear a lot from CHIME members is the importance of providing just a safe working environment. We'll talk more about this in our next session, but because you're a nurse, you have a nursing background. Can you speak to how important it is as a healthcare leader, right, and the role that you can play to help provide safe working environments for nurses and clinicians?
Yeah, I mean, I think it's even with the most recent tragedy that happened last week, I
Yeah,
think it's becoming more and more important to understand the risks that are out there. And we've had lots of conversation around, are there technologies that we can help to prevent, a situation like that if there's risk. But I would say that after COVID, we've had such a large increase on workplace violence in the sense that patients are less tolerable, and all of our security officers have been assaulted in one shape,
yeah,
one way or form, at least once a quarter. And so one of the things that we're trying to do is how do we train to de-escalate and then use technology to help with that. So we have some some cameras in the room that has AI on it that we are using, where we and deployed help buttons on the back of badges to help alert. We have a safe word that they can say to help alert. And the idea is to get help in the room before it actually escalates. We just approved to have canines into our facilities, and not aggressive in the sense that they're gonna like a police dog, but the presence of the dog can actually help as
can
well.
be
So
de-escalating, right? So just
yeah,
the
it's
the
all
presence of the dog.
de-escalating technologies, but then also equipping people with the with with the right information to say this is not okay. I don't feel
Yeah,
safe,
yeah,
and to be okay with that, uh, including peer to peer, right? So providing that safe environment for that as well.
yeah. I appreciate you being willing to speak to that. As I mentioned, your role spans well beyond IT. You're a healthcare leader and healthcare executive, and unfortunately, these very challenging issues. And how do we protect our workforce and create opportunities for them to work top of license and really
Yep,
thrive in the
that-
face of a lot of challenges, unfortunately,
Yeah.
today. Terry, you mentioned the power of really leading with empathy, and there's no doubt in my mind that you are very clearly an empathetic leader. Can you speak a little bit more to why that is important to you and why you feel it's so effective in helping to build that resilience across your teams?
I think primarily it's most effective because if they see you as part of the team and not just top down,
Yeah.
then they're more willing to follow. And what I mean by that is I on every go live I'm present. And being present and visible makes them know that I'm in it with them. I also take away the brunt of like the escalations and some of those things and protect them a bit. But
Yeah.
I think if they understand that I'm doing it too, that it's not this, you're special and I have to do this. It is really a team approach. And I don't, it's, it's, it's more collaborative. I'm not directing. They're just doing because they see that that's the right thing to do.
Yeah.
I think also my nursing background allows me to translate. And I think a lot of times the ticket's placed and there's a loss of translation. But if I can go back to that why, if I could say this is the why and connect them, which is why the rounding is so important too,
Yeah.
is because they can see it. When people see other people struggling, they want to help.
Yeah.
You miss that connection if you're not actually doing the rounding and understand the why behind what we're doing. And I think that if they know that I'm in it with them, it's it's a team approach.
Yeah. Great. I want to circle back to something you shared earlier in terms of, celebrating with your team, and whether it's a small victory or big victory, it's important to really acknowledge team efforts and some of those wins. A little bit later this afternoon, we're going to talk about the fact that most healthcare organizations are facing real financial constraints. So my question to you is, do you have some examples of some fun things or things that you can do to help celebrate with your team, acknowledge their great work, that are maybe low cost or no cost that they really enjoy?
Yeah, so yesterday we had a holiday party, and we did simple things like the ugly sweater contest. We did a pass the gift kind of situation, a $5 gift, kind of like a white elephant. Um, my leadership team actually chipped in and provided the food. So, again, not something that was charged to Guthrie. It
Yeah.
was something that we could do in the middle of the day. They enjoyed, and they got really creative with their ugly sweaters, like homemade ugly sweaters, not bought off of it,
Love to
because
see
it's such
some
a big.
photos.
And had a little dance contest. You have to be okay with being a little bit goofy,
Yeah.
and being a little bit vulnerable. And I think that the team has, particularly because we have a small community, they're great at. And I have like a committee that actually looks for like the fun committee. So what are the things? I actually collect all the stuff that we get from conferences and things like that, and I usually save it for raffles. I mean, I think that there's a lot of ways that you can kind of give them appreciation, but sometimes, honestly, just a thank you in an email, a recognition
Yeah.
is the most meaningful. I also like to write handwritten notes, because I think the most important thing that you can give an individual is time, and taking the time to write
Absolutely.
that handwritten note is really meaningful.
Yeah, and I don't know about you, but outside of bills and junk mail, the rare letter or thank you card that you might
And
get in the mail actually really, really resonates, right? And so I like to do the same thing with our team members as well. We're down to just the last couple of minutes. I really want to circle back to you, right? You are a very hardworking leader. What are some things that you do in your life to make sure that you're managing that work-life balance and staying strong and healthy as well?
Yeah, I think, everybody needs to recognize what they like to do outside of work. I've made a very conscious effort on self-care, and that doesn't mean like spas and things for me that's not available in my area, but I do take, fitness is something that I enjoy and I always make time for it. Now I have to recognize that my job is demanding and that, how does that fit in, and recognize where I can control that. The mornings when I wake up is what I can control. That's the part of the day that I
Yeah.
can control. So those are the things that I do that I like the best. I also make sure that I disconnect in the evening. We have the ability to page each other through a paging system if there's an urgent matter, but I try to stay off my phone. If you're on your phone all the time, you're going to get pulled in. There's always going to be emails, always. So
Never goes away.
Yes, it never goes away.
The last minute or two left here, you sort of concluded your presentation with a call to action. Is there anything you'd like to share to your colleagues or peers who are out there who, like you, are spending maybe 60% of their time on workforce issues? Maybe if there's one piece of advice that you could offer that you'd like to leave them with?
I say the time that I spend on these issues is probably the most value added time that I give to this organization. And why I say that is because there's always another organization that can offer more money. But when somebody feels connected to the mission and the purpose and to the leader, they are more likely to not worry about the money. There
Yeah.
are other ways to compensate individuals. And so, and again, that time, getting to know your team. And some of the, I mean, I know some people have very large teams, but where it's feasible, make sure that you invest that time. There's nothing more important than given this, even through a Teams call where you're not on your phone, you're not answering an email, but you're actually talking to them and truly interested in what they have to say.
Yeah, 100% focused on them in that moment, right? Terri, thank you for being the amazing leader that you are each and every day, but also thank you again for being willing to come here and share some of your thoughts and really get the conversation started around building workforce resilience. We really appreciate your time today. With that, we're going to take a short break. Don't go too far. We have our first panel session of today coming up. We're going to talk about best practices in promoting employee safety, well-being, and mental health, all critical issues for health IT executives and health executives today, as you just heard from Terri Couts. So join us right back here at 1:45 p.m. Eastern for our first panel session of the day. And we'll see you then. Thanks again, Terri.